I have the honor of working with some incredible teammates on this project, but we are looking at healthcare utilization within the first 12 weeks postpartum. So just a little bit of background on why we wanted to look at this in particular. The postpartum period, often called the fourth trimester, is an incredibly critical time for moms. You have to manage recovery from the birthing experience, address any potential complications, monitor for emergent issues, and then understanding that a healthy postpartum course can help predict a healthy life course for mom and baby. Recommendations in terms of how often and when a postpartum patient should be seen by their provider are in flux, to be honest. Recent changes within the American College of Obstetricians and Gynecologists here in the United States have changed their recommendation to have follow-up within the first 3 weeks postpartum, ongoing person-centered care as needed, which is quite vague, and then ending with a comprehensive visit no later than 12 weeks postpartum. There is a lot of variation on postpartum visit attendance, anywhere from 25% of patients to 97% of patients follow up with their healthcare provider postpartum. And it really is such a critical time. Here in the United States, almost 2/3 of maternal or pregnancy-related deaths happen in the postpartum period. And so, we have this need for patients to be in touch with their clinicians to make sure that their postpartum course is going as expected, and that if complications arise, they are addressed quickly to prevent morbidity or mortality. So looking at our project objectives, our purpose was to assess postpartum follow-up in the first 12 weeks after delivery in patients who have a live singleton birth. And Kevin, I saw your comment in the chat about not feeling seen as a twin, and I apologize for the twin erasure. Not intentional, just the singleton birth keeps it a little bit more straightforward. Our primary objective was to calculate the proportion of postpartum patients that follow up with a provider in the health system that they delivered at within the first 12 weeks after that delivery. We also have some secondary objectives, and that's to assess when and where these follow-up visits occur. Are they happening in an outpatient setting? Are they being seen in the emergency department? Are they being seen at 2 weeks, within 6 weeks, within 12 weeks? So really looking at the when and the where, and then to conduct a sensitivity analysis to determine if postpartum follow-up rates are higher among patients who received any prenatal care within the system that they delivered and then are seen postpartum. So looking at our cohorts, we developed 2 cohorts, one that we called the prenatal care and one the no observed prenatal care. So both of them have an entry event of a singleton live birth, female, aged 12 to 55. And then the prenatal care group has at least one procedure or observation of what we called a concept of prenatal care within 250 days prior to the entry event or birth. Our no observed prenatal care still had the birth, same demographic inclusion criteria, but they had no procedure or observation of a prenatal exam concept set within the 250 days prior to birth. So what is that prenatal care concept set? Well, this is one of those learning opportunities where we discovered it's not as straightforward as just saying, did they have prenatal care or not? Based on EHR data, what gets coded as prenatal care can vary. And so it wasn't as easy as we thought it would be. But we went through and included and excluded various components of obstetric care. The most commonly included procedure that is involved in this prenatal care concept set is a uterine ultrasound and a pregnancy-related examination. There were, when we went through and looked at routine obstetrical care, there were a lot of things that didn't make sense for the prenatal period, things like postnatal exams, repair of lacerations that happened in delivery, intrapartum fetal monitoring, things that happen at birth or after birth. But we really wanted to capture patients that were seen within that healthcare system prior to delivery. And there were a lot that had 0 record counts as well. So looking at our outcomes of interest, what healthcare settings are utilized by postpartum patients? Outpatient, emergency department, or inpatient? when does that utilization take place? Within 2 weeks, 6 weeks, or 12 weeks postpartum. And then again, that comparison between the cohort with the prenatal care within the system and the cohort without. So we have some very preliminary results to share, but cohort 1 is again the one with any prenatal care within the system, and cohort 2 that did not have any observed prenatal care within their system. You can see we had about 42,000 patients in cohort 1 and about 57,000 in cohort 2. You can see here, any follow-up within 2 weeks, about 24% with prenatal care, about 20 without. And then you can see the breakdown. Most of these are happening in the outpatient setting, which I think is typical when we think of postpartum care, is that they're seen by their OB/GYN provider in the outpatient setting. But you can see we did have some ER visits as well as some inpatient visits. Within 6 weeks, you can see again about 43% for our patients with prenatal care, about 36% for no. And again, you can see again that the vast majority of these patients are seen in the outpatient setting. But I do think it's interesting, and I have to run these to make sure that to see if they're statistically significant, but you do start to see some creeping up of patients seen in the emergency department. And then within 12 weeks, 60%, 61% versus about 50%. So there are definitely some observed differences that we saw between cohort 1 with the prenatal care in the system and cohort 2 without the prenatal care in the system. Some of the limitations that we observed, accuracy of our phenotypes, may not capture care of patients only seen for delivery. So for example, how many patients get prenatal care outside of the hospital system in which they deliver? Yes, maybe their obstetrician gynecologist is affiliated with this hospital for delivery or has delivering privileges, but their practice is a standalone practice. That happens. Or how many patients are seen maybe one time for an ultrasound with the maternal fetal medicine specialist that's associated with the hospital that they deliver at, but that was just for that one ultrasound. And again, their provider is outside of the system and they see them postpartum. So those people wouldn't be necessarily captured in the way that we have it outlined now. And then of course, any incomplete or missing data. Again, this as straightforward as our question seems, it really is interesting to start to dive into observational data and say, okay, are these people, are they capturing prenatal care the way that we think about prenatal care? Are they capturing postpartum care the way that we think about postpartum care? And so what I really love, and I think is important to highlight about our question in particular, is that it's a jumping off point, right? There are so many different avenues that we could take this interaction with the healthcare system postpartum. We can look at it demographically, and we can look at it insurance coverage versus no insurance coverage, especially when you think about states that have expanded postpartum Medicaid to 6 months or a year to see what the rates of follow-up look like for those patients. Looking at rural versus urban demographics, what is the care like in those settings? And so it's really an exciting question to kind of choose your own adventure and say, I know I want to look at postpartum utilization, but how do I want to look at it? And so I think that's a really exciting feature of our question. Of course, I want to acknowledge Johns Hopkins for their willingness to be our data partner, the wonderful Maternal Health Data Science Fellowship team. Quite literally couldn't have done this without them. It's been really exciting as a clinician to dive into this work and to see just how much, my favorite part about OHDSI is how much of a team sport it is. I went to the Global Symposium in October, and I loved the activity where it's like build your team. And I think that this data science fellowship is a perfect example of building that team, and it's been really fun to work with everybody. If you're interested in becoming a data partner, please reach out. We'd love to have you. Again, the bigger that we can make this study, the more insightful that those answers will be. So thank you so much.